Did you realize that physicians can quickly detect severe medical problems simply by observing specific cleanliness errors in their older clients? These harmless routines may be quietly signaling you about potential hazardous issues forming in your system right now. What's genuinely alarming is that most older adults are unaware they're committing these vital mistakes daily. In the upcoming moments, I'll disclose the 7 personal cleanliness errors that physicians instantly recognize in their senior clients and how correcting them could truly preserve your life or that of someone dear. The details I'm about to provide are seldom addressed in medical offices, rarely highlighted in wellness publications, and not covered in classrooms. Yet, they could mean the difference between enjoying your later years with vitality or enduring avoidable ailments that steal your autonomy and self-respect. Let me share the story of Harold, a 75-year-old former technician who believed his self-care habits were entirely adequate. Harold was engaged in his neighborhood, enjoyed golf bi-weekly, and always attended his grandkids' sports events. During what he considered a standard examination, his physician promptly identified 3 critical cleanliness errors that showed Harold had been developing a grave condition for months unknowingly. "I had no clue," Harold later confided to me. "I thought I was maintaining my health well. If my physician hadn't identified these seemingly minor cleanliness issues, I might not be alive today to share my story." Today, I'll reveal precisely what those errors were so you can steer clear of Harold's terrifying ordeal. More crucially, I'll explain exactly what to do instead, simple adjustments that could extend your life starting now. Mistake 1. Overlooking oral cleanliness. When was the last time you thoroughly inspected your toothbrush? Is it tattered and worn? Are you brushing diligently twice daily? And here's a more critical query. Did you know that subpar dental care isn't just about foul breath or tooth decay? It's directly tied to heart issues, strokes, and even cognitive decline. Geriatric experts at Harvard Medical School have confirmed that bacteria from neglected gum disease can enter your bloodstream and trigger life-threatening cardiac conditions. Their studies indicate that older adults with poor oral hygiene are 3 times more likely to experience heart-related issues than those who maintain proper dental habits. But don't just trust my words. Let me tell you about Sylvia, a 68-year-old former educator from Oregon. Sylvia disregarded her bleeding gums for months, assuming it was typical for her age. "I just thought that's what occurs as you age," she said. But during a routine checkup, her heart specialist found dangerous inflammation in her heart valves, directly caused by oral bacteria that had spread through her bloodstream. The physician warned that if she had delayed just a few more months, the damage might have been permanent. What should you do now? First, check your toothbrush. If it's over 3 months old or shows any wear, replace it immediately. Ideally, switch to an electric toothbrush, which removes 62% more plaque than manual brushing, according to research from the University of Pennsylvania Dental School. Brush twice daily for a full 2 minutes each time. Use a timer if necessary. Floss every night without fail, and never skip dental visits, even if you wear dentures. Have you noticed bleeding when brushing or swollen gums? These aren't typical aging signs, they're alerts your body is sending. Please don't ignore them for another day. Mistake 2. Irregular bathing and skin maintenance. How frequently do you bathe? Be truthful with yourself. Many older adults reduce their bathing as they age, but did you know your skin is your largest organ, and changes in its state can reveal serious internal issues before other symptoms emerge? Dermatologists from the Mayo Clinic caution that decreased bathing in seniors often conceals early signs of diabetes, liver issues, and heart problems. Their clinical research shows that nearly 40% of undiagnosed health conditions in older clients could have been detected earlier through proper skin monitoring. Consider Clarence, a 77-year-old former mail carrier from Michigan. Clarence thought bathing weekly was enough, especially in winter when his skin felt parched. "I didn't want to dry out my skin," he explained. But when his physician noticed unusual skin discoloration during a visit for an unrelated issue, further tests revealed early-stage kidney disease. The discoloration wasn't due to poor cleanliness itself. Instead, infrequent bathing had masked a critical symptom that could have been noticed weeks earlier. What's the solution? Establish a regular bathing routine, at least 3 times weekly, even if you're not very active. Use mild, unscented soap that won't strip your skin's natural oils. After bathing, apply moisturizer while your skin is still slightly damp to seal. In hydration, most importantly, regularly check your skin for unusual changes in color, texture, or sensation. Are you noticing dry, flaky patches, odd discoloration, or areas that itch persistently? These could be your body's way of warning you about something far more serious happening internally. Don't wait another day to address these signals. Mistake 3. Neglecting nail maintenance. Take a moment now to examine your fingernails and toenails. What do you observe? Are they neatly trimmed, clean underneath, free from discoloration? The state of your nails is a window into your overall health that physicians check immediately when assessing older clients. According to the American Academy of Dermatology, nail changes can signal over 20 different systemic conditions, ranging from anemia to thyroid disorders to heart disease. Their research shows that in clients over 6, nail abnormalities led to the diagnosis of previously undetected internal conditions in nearly 30% of cases. Let me share Beatrice's story. At 82, Beatrice didn't think her thickening, yellowing toenails were concerning. She stopped wearing sandals and hid them in closed shoes. I thought it was just part of aging, she told me. But when she finally visited a podiatrist for foot pain, the doctor immediately diagnosed a fungal infection that had been allowed to thrive for so long, which revealed a severely compromised immune system. Further tests uncovered a serious underlying condition that needed urgent treatment. What should you do today? Trim your nails regularly, straight across with slightly rounded edges to prevent ingrown nails. Keep them clean and dry. Wear breathable footwear and change socks daily. Never ignore changes in nail color, texture, or thickness. These aren't cosmetic issues, they're potential alerts from your body. Are your nails brittle, discolored, or thickened? These changes aren't inevitable parts of aging. They're your body trying to communicate something important. Will you listen before it's too late? Mistake 4. Improper incontinence. Handling this is perhaps the most surprising cleanliness error due to its prevalence and the desperate attempts people make to conceal it. Over 50% of older adults quietly deal with some form of incontinence, but the truly shocking part is how many hide it instead of seeking proper care. Urologists from Johns Hopkins Medicine report that untreated incontinence leads to dangerous skin infections, falls, social withdrawal, and can mask severe conditions like bladder or prostate cancer. Their studies show that seniors who properly manage incontinence issues have 60% fewer complications than those who try to hide the problem. Take Douglas, a 73-year-old former accountant from Arizona. Douglas was too embarrassed to mention his occasional leakage to his physician, using paper towels and changing clothes frequently, thinking he was managing the issue. When he finally sought help after developing painful sores, doctors discovered an advanced prostate condition that could have been treated months earlier with better outcomes. My pride nearly cost me my life, Douglas admitted. I wish I had talked to my physician at the first sign of trouble instead of trying to hide it. What should you do if you're experiencing incontinence? First, never be ashamed to discuss bladder issues with your physician. They see this daily. Use proper absorbent products designed for incontinence, not makeshift solutions. Change promptly when wet and follow an appropriate cleansing routine to prevent skin breakdown. Most importantly, recognize that incontinence isn't a regular part of aging. It's often a symptom of something needing medical attention. Are you experiencing occasional leakage, planning outings around bathroom availability, or using makeshift protection? Don't wait another day to speak with your physician. Your health, and possibly your life, may depend on it. Mistake 5. Ear cleanliness mistakes. What's your ear cleaning routine? Be honest, are you using cotton swabs, inserting them deep into your ear canal? If so, you're making a dangerous mistake that many older adults commit daily. Many seniors are harming their hearing and missing signs of serious infections by using improper ear cleaning methods. Otolaryngologists warn that improper ear cleaning causes nearly 40% of ear canal injuries in clients over 65, with many cases leading to infections that could have been avoided entirely. Let me tell you about Patricia, a 71-year-old former librarian from Washington. Patricia regularly used cotton swabs to clean deep inside her ears until she punctured her eardrum, leading to a severe infection that spread to nearby tissue. I had always cleaned my ears this way, she explained. No one ever told me it was dangerous. Patricia required emergency treatment and suffered permanent hearing damage that could have been completely avoided. What's the correct approach to ear cleanliness? Follow this simple rule. Never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp washcloth if you feel excess wax. Use eardrops designed to soften wax, following package directions precisely. See a physician immediately if you experience pain, discharge, or changes in your hearing. Are your ears itchy, feeling full, or blocked? Are you experiencing unexplained hearing changes? Don't attempt to resolve these problems yourself. They require professional medical attention. Your hearing is precious. Protect it with proper care. Mistake 6. Poor foot cleanliness. When did you last thoroughly inspect your feet? Not just a glance, but a detailed examination of every part, between the toes, the heels, the soles. Your feet hold vital clues about your circulatory and nervous systems that physicians check first in older clients. Podiatrists specializing in geriatric care at the American Podiatric Medical Association state that foot cleanliness issues often reveal the first signs of diabetes, neuropathy, and vascular disease. Their studies show that in clients over 60, proper foot care and regular inspection could prevent up to 85% of diabetes-related amputations. That's not a typo. 5% of amputations could be prevented with proper foot care. Consider Raymond, a 76-year-old former factory worker from Illinois. Raymond ignored the dryness and minor cuts on his feet, assuming they were typical signs of aging. My feet had been looking rough for years, he admitted, but when his physician noticed them during a routine exam, he immediately ordered diabetes testing, catching the disease early when lifestyle changes could still make a significant difference. If my physician hadn't checked my feet, I might have gone years without knowing I had diabetes, Raymond told me. By then, the damage would have been severe. What should you do, starting today? Wash and thoroughly dry your feet daily, especially between the toes where fungus thrives. Inspect them regularly for cuts, sores, or changes in color or temperature. Wear clean, dry socks made of natural fibers or moisture-wicking materials. Apply moisturizer to dry areas but not between the toes, and never ignore pain, numbness, or wounds that don't heal. See a medical professional immediately. Are your feet dry and cracked? Notice any cuts that aren't healing correctly, unusual discoloration, or loss of feeling. These aren't just cosmetic issues, they could be early warning signs of severe conditions that need immediate attention. Mistake 7. Medication-related cleanliness. Issues are, you taking multiple medications? Have you noticed changes in your body scent, sweating patterns, or mouth dryness since starting them? The medications keeping you healthy might be causing cleanliness problems that signal dangerous side effects. Pharmacologists at the American Geriatric Society have documented how certain commonly prescribed drugs can cause dry mouth, excessive sweating, or changes in body scent, indicating potential toxicity. Their research shows that nearly 40% of adverse drug reactions in seniors present first as changes in personal cleanliness needs before more serious symptoms appear. Take Barbara, a 67-year-old former nurse from Florida. Her family dismissed Barbara's unusual body scent as poor cleanliness until her geriatrician recognized it as a sign of medication toxicity that was slowly damaging her liver. I was showering regularly and using deodorant, Barbara explained. I had no idea the smell was coming from inside my body, not from lack of cleanliness. What can you do to protect yourself? Track all changes in cleanliness after starting new medications. Keep a simple journal, noting any differences in body scent, sweating, mouth dryness, or skin changes. Stay adequately hydrated unless otherwise instructed by your physician. Report unusual sweating or changes in scent to your physician immediately, as these may indicate potentially dangerous drug interactions. Never adjust dosages without medical supervision, even if you think the medication is causing cleanliness issues. Have you noticed an unusual body odor despite regular bathing, excessive sweating, or an extremely dry mouth? Don't attribute these changes to normal aging. They could be warning you of potentially life-threatening medication effects that need immediate attention. Now you know the 7 critical cleanliness mistakes that physicians instantly notice in their older clients and exactly how to correct them. By addressing these issues today, you can prevent serious health problems, maintain your dignity and autonomy, and extend your life. Proper cleanliness isn't just about appearance or social courtesies, a vital part of keeping your health as you age, and these simple changes could truly save your life. If you found this information helpful, please press the like button now. Has your physician ever noticed any of these cleanliness issues during your visits? Share your experience in the comments below. Don't forget to subscribe and activate the notification bell. To receive more potentially life-saving health information like this, please share this video with your loved ones over 60. This knowledge could truly save their lives.